Hi, my name is Diana Karamakoska, and this week we are looking at interviews. Interviewing someone is not as easy as it sounds. Have you been for a formal interview before? Whether it was for a job or when you were sitting down at the doctor's office? Try to think back to the feelings you had before and after the interview. Did it seem quite daunting? Were you nervous, scared of the uncertainty? Or did you come out feeling great, feeling like there was something that was clarified and you don't have to worry anymore? Well, when we sit down to interview someone as a health professional, there are a number of things we need to consider when we begin these interviews. There are a few key factors in interviewing a client or a patient. You must be able to put them at ease, and you can do that by smiling frequently and speaking to them in a calm and soft manner. You must be professional at all times, in your presentation and also in the way you speak to them. Ensure of confidentiality. Do not share personal information with other health professionals, only what is relevant to the case or the client or the patient. Be client-centered. They are your first priority, and you must always act in their best interest. Use social discussion to get them talking when you are beginning an interview, asking general questions about how they are, how they've been feeling, what they do, how things have been going for them, etc., etc. Also listen to their responses and genuinely listen, as you can nod throughout the conversation, and this will ensure them that you are listening and understanding what they are saying. When you put people at ease, you should try to introduce yourself first, and also what your role is and why they are there to see you. Smile. Make sure you look professional in the way that you are dressed and the way that you appear. Wear a uniform or a clothing that is appropriate to your position or your profession, and also consider your presentation, so looking clean and neat for your patient. So what is an interview? An interview is a conversation with a purpose. Interviews are, by their very nature, social encounters. Speakers collaborate in producing retrospective and prospective accounts or versions of their past or future actions, experiences, feelings, and thoughts. There are different types of interviews that can be conducted. The first one is of a structured kind. This involves answering a set of closed questions, and they are specifically focused on what the interviewer needs to know. They have set questions or a set order of questions that will be presented. The second type of interview is a semi-structured one, and there's greater scope for negotiation in this type of interview between the interviewer and the client or the patient. There is a phrasing and inclusion of certain questions, but specific topics are required to be covered. However, that doesn't mean we can't explore further into what our patient or client is telling us. The interview schedule or a form can be used, and this reminds interviewers of the questions that need to be answered, but it is not set in a particular order or format. And the last type of interview is an unstructured one. There are limited but open questions or themes on a topic in which the discussion is guided by the participant. And there are different types of questions that need to be answered in these interviews. You need to consider which types will elicit the best responses. So for a more direct approach to a question, you may ask the client something along the lines of, have you ever been to a CAM practitioner? Do you participate in regular exercise? Having direct questioning will lead to more factual information that is produced in their answers. Indirect questions, however, ask for the perception or experiential information that a client may have. So you can phrase this by asking someone, can you tell me about the last time you visited a health practitioner? And why do you think you struggle to get to the gym each week? These types of questions tend to be used more in the semi-structured or open, unstructured formats, where the participant is able to elaborate further on the details required from the interviewer.